going to be bringing you.
يطيب لي أن أرحب بكم في فعاليات هذا الحوار رفيع المستوى.
We are bringing you now this panel in line with the activities of Global Congress on Population Health and Human Development. In October of the year 2024, Dr. Khalid Abdel Ghaffar, Deputy Prime Minister and Minister of Health and Population, he handed President Abdel Fattah al-Sisi, the head of state, a copy of the strategy, the national strategy for health and population for 2024-2030. And now, after a whole year that have passed for implementing this strategy 2024-2030, we are here today to take a comprehensive look over the achievements that were effected and the challenges that are laying ahead still for this strategy. And what are the types of means in our hands for the coming 5 years. The National Strategy for Health and Population 2024-2030 is a panel, a governmental civil panel that comprise empowering the health file and empowering the health security and also taking precautions for pandemics and disease and upgrading the health services and empowering scientific research. In this panel, we today are embarking together to discuss all that. Let me welcome our dear speakers on the panel, on the podium. Let me take this opportunity to start with a question. We'll start off with Deputy Prime Minister and Minister of Health and Population, Dr. Khalid Abdel Ghaffar. In the light of all the statistics that were taken last year and by the time you started taking over this file, what were the most important challenges that stood before you while implementing the strategy? What's your vision over sustainable developed government in the coming 5 years, starting from where we're standing now? Thank you, Dr. Ahmed Muslimani. I really welcome all of you and express my gratitude to you. Let me borrow this word from Mr. Muslimani, the national strategy for development. You have seen all the efforts that were existed by the different governmental sectors. It's an issue of a whole nation, a whole state, not only an issue of a certain sector in the government. And it's a very important approach. Every ministry and government every ministry has a responsibility to share in this national strategy. And we have issued a social determinants of health that is looking over upgrading the livelihoods and the health conditions of Egyptians through different civil initiatives like 100 million lives and Haya Karima, decent life, and many other initiatives, governmental initiatives. This is not only an initiative or a strategy by the Ministry of Health, but like I said, it's an assignment for the whole nation. When we look over the national strategy for health, we could be all held accountable for anything, any deficiency that might have happened or might have not had happened last year. In light of what we have witnessed last year, I could say that 60% was achieved, not bad at all for only 1 year. What are the challenges? If we could look for the challenges, part of these challenges is humane And also other challenges are statistics and imbalances. When I look at my colleagues, Dr. Rania Al-Mashat, the Minister of Planning, Economic Development, International Cooperation, she has spared a lot of effort and focus over this strategy. But sometimes the budget that is being provided for these for these visions could have some deficiencies, but still the defiance of what you want to achieve and what you have on hands on reality on the ground. We have affected a lot on different governorates, and that would require a lot of effort and a lot of cost on the ground from the government. But we cannot achieve that only overnight. We need over 150 billion Egyptian pounds to be able to achieve what we want. And this is the most huge or the biggest challenge for us. We also have strategic planning and thinking, and while we were effecting that particular plan 2024, we had in mind to transfer the individual work transform it into an all-governmental governing work. It's a governmental work that we have studied very well before in advance, and we have been training people to apply for a long time before we apply. And we have negotiated many items in it before we apply it and before we implement it, so that we could be able to achieve our goals. Like I said, we had so many partners in this, but the only challenge that was lying before our eyes is that people should have the potential to be able to have the urge and passion and urge to be able to implement this initiative or this vision seriously. But usually some differences is affected between different governorates and from one place to the other. It's not always the same. The third challenge is digitalization. The whole world is now inquiring the means of digitalization, like those we implemented in the health insurance system that we implemented in almost 14 governorates, and we were very successful in it. It looks easy, but when it comes to cost and training, and if we need to implement governing in that particular issue, it is very difficult. I could say that those are the main challenges that met us while we were implementing this strategy. Thank you so much, Your Excellency. I'm going to be back to you. Then let me welcome Her Excellency Minister of Planning, Economic Development, International Cooperation, Dr. Rania Al-Mashat. The national strategy for health and population, and there is also the potentials for economic development and for economic and social development. How can we balance between both? Thank you very much, Dr. Muslimani. Let me extend my greetings or my respect to the attendees and of course Prime Minister, Deputy Prime Minister Dr. Khaled Abdel Ghaffar. We cannot issue any goals without having a clear strategy and clear vision. We start off with different age grades and also geographic divisions, and also looking over the map, the health map, and the service map, which is very important. Let me tell you, when we talk about planning, lately in the last few months, we have been directing our consideration for balancing between the developmental part and the developmental part, and also the budget that is being, or the investment on humanity. This is very important, and it could be the first and foremost point before we start implementing anything. And so also the tie between both parts. We as a government, we as a ministry, our mission is to hold all parts together and bring together other ministries. There is also the Ministry of Endowment, also the Ministry of Solidarity, and we could see that there is inclusion in this. So if we could look over both programs and efficiency through a plan or a vision that is regarding this, and classifying this into different shades that we have also affected. Through this, we succeeded in directing all our efforts and focus towards the best services that could be done and could excel and speed up with this process. So the first thing we would effect political planning and also collaboration between different ministries. It should be not only developmental or political, but should be also economic also at the same time. And also the mobilization between different missions that is also affecting the health program. The second part is there is a journal or a directory that is instructing us how to effect that balance between budget and between efficiency in collaborating all our efforts together. And also, when it comes to inclusion, it is a very big issue. We sometimes will have to look over the gaps or different gaps while we are effecting our program, and the health program would come and fill in these gaps. So it's a collaboration between the health ministry and also Ministry of Solidarity and other ministries. There are also reports that are continuously issued to be able to bring us the latest on the latest happening, and also some assistance from abroad and from expertise. We're going to be coming back to you, Your Excellency, Minister Al-Mashat, Mr. Ahmed Abdelhamid Taha, the head of the Unified Health Insurance Authority. How did the Qatar directory affect the health file, and how did that direct all the hospitals to be able to upgrade their services? Thank you so much, Dr. Muslimani. Let me just extend my congratulations to the Deputy Prime Minister, Minister of Health and Population, Dr. Khaled Abdel Fattah, on the success of Global Congress on Population, Health and Human Development. That allowed us to be sitting here after the success of that initiative that was taken, or the vision, the national strategy that was taken 1 year back. And as a result of this vision, the success of this vision, we're standing here and we're negotiating the achievements. Let me also welcome and extend my congratulations to Dr. Rania Al-Mashat, who is responsible of the planning and economic development, or the planning file in Egypt, who is sharing with a great deal in that particular vision, 2024-2030. Let me just confirm that the main strategic aim, the first and foremost for any health file, is importantly, on the first place, giving the best health services that provides security and safety for the people and the citizen, where he could get all the medication and all the medical treatments at hospitals in a safe haven and a safe environment, when there is zero mistakes by doctors and malpractices by any medical institution. Also, among the things that is supposed to be provided in this also file, which is the training and a good environment in the sense of work, and the sense of salary, and the sense of knowledge, and the sense of awareness. This is not going to happen except without different measures like Gahar. It is very important to be having some measures, very upgraded measures, to be able to achieve sustainability without any mistakes, without any malpractices. Also, it is very important to be able to effect a very healthy and safe environment, medical environment. That is also qualified to the international standards according to the 2018 law, medical law, for the first time, that was established for the first time. Let me say that the Health Ministry is responsible for issuing those measures that is complying with international standards. Those measures have to be upgraded every year to comply with the international standards and the medical competence worldwide. Now we are to be asked about the application of all those measures in the best way. If we stand still, we do not upgrade ourselves, then we are not going to be competing with the international standards. But now we are not standing, so we are assessing ourselves each year. You are asking me, what did we achieve last year? The health surveillance that has been looking after our achievements. We have effected 150 medical institutions throughout last year. 651 also centers, medical centers and institutions that were affected. That was not affected affected in different governorates in light of the health insurance of the country, but it also comprised 120 governors. We were spreading health awareness, which is very important, and making sure that everybody is being medically educated as much as we can throughout the different governorates in Egypt. What were the challenges, you asked? I could tell you that the most and the difficult challenge that we met in this file, that our job required a continuous change of cultural backgrounds, that require our change of attitude, our change of beliefs in difficult spheres of knowledge in medicine. Also, a complete updated or a complete update of our knowledge about medical services to the citizen. And that's why and in this light we could be able to held those in charge accountable in the case of any malpractice. So it is the culture that is not built on blaming other or picking up on other, but it is the culture that is reaching to the roots of the mistake. Thank you so much, Mrs. May Farid, the Executive Director of the General Health Insurance of Egypt. Let me talk to you, or let me ask you about the challenges that met you. How is that affected the general health insurance, and the main lessons that were taken from those difficulties that met you last year? Let me tell you, it is just only 6 lessons that I've learned. Preparedness in most of the governorates, the geopolitical location and the graphics of each government is one of the most important lessons. The private medical services or units for the governments is also one of the lessons that we have learned, and it was a big challenge that required a complete makeover of our mindset, in our mindset and the people's mindset. And also the third lesson is the digitalization, which was not an option but an obligatory mean for us to be taking. And the fourth one is partnership with the private sector and also different specialization. Those were among the most important lessons that we have acquired in the field of, for us, the people giving medical services. Also, we have benefited a lot from exchanging expertise with different and taking successful experiences from other countries. We have borrowed very successful experiences from and lessons from other countries. And we have also built on our opinions and visions on strategies and statistics that were seriously taken and built by other people. This all have helped us and assisted us on taking decisions that would come to the best interest of the citizen. Let me reach on to Dr. Tariq Muharram, a representative of the private sector. There are 2 main channels. The private sector investment in escalating this national strategy, and the second one is the partnership between the private and the governmental sector is the second one. Thank you so much for allowing me to on the podium, on such an important podium that gather those important partners that have been partners with us as the private sector. It was very beneficial on our part to be part of this process. The collaboration between the private sector and the government has been regarded not the best way. But lately, the last 2 years, there was an excellent inclusion between the different initiatives given by the Ministry of Health and Population, and that culminated in the hospital of Gustav, the hospital that is eradicated or that is erected or built to be able to treat cancer patients, hopefully in the near future. And this is a good proof of our inclusion and our good collaboration. Great parts of this process could be provided only by the private sector. When the good environment is provided, when there is encouragement on the government part, and when it is governed by a KPI measure that is protecting all the medical institutions that might be harmed by non-measurable and objective measurements and judgment by others, to be able to judge it in a wrong way. Let me just talk about the challenges and the efforts to escalate the vision, the national strategy, health vision. Actually, some parts of this vision implemented the KPI measures, and some didn't until now. But the collaboration between the French institution Gustave, that is about to be established here for cancer treatment here in Egypt, hopefully in the near future, and the private sector is really very promising, because the French partner will never allow to take its reputation. The institution, the French institution of Gustave, is not going to allow anybody to take its reputation down the drain. That's why they're very keen on spending all their best efforts. We have achieved a lot of success. 87% were achieved in the of quality standard terms were achieved in the Gustave institution, the French Gustave institution. There are other, of course. There is also the issue of mentality and culture and knowledge and adaptation in the midst of fears and probably the media confrontation and provocation, sensational media and all that. These are all challenges that we met and have handled with flexibility and with understanding. And finally, let me say, the partnership in its own right in the legislative side is almost for 15 years. That hopefully would take the capacity of many other future partnerships. But actually today we are talking about a project that has been effected for 2 years, which is the French Gustave Institution. 90% of its services is going to the governmental health insurance that is covering 100% of the medication for cancer patients in Egypt, which is very, very costly. However, it is all covered by the government. Thank you so much. Thank you, Dr. Tara. And let me, before we end this panel, we move to the WHO representative in Egypt. From the WHO's vision, how do you assess the national strategy in accordance with the 17 goals of sustainable development? Of course, great achievements were taken during that year. Let me take, for example, the virus C, great achievement for the first time in the only country in the whole region and the first country in the world to defeat the virus C and eradicate it entirely, that is Egypt. And we are very proud of that. And also manufacturing the medication for it also locally here. That is sustainable development and a best example of sustainable development. Also, let me again confirm that the manufacturing of the medication for virus C here in Egypt, 100% Egyptian made, and that is exported also to different neighboring countries and other countries outside the Arab region like Pakistan. And also the polio that also was, when we talk about polio, people say that we have the problem of virus C, and people are now borrowing the very successful experience of the Egyptian government in defeating this undefeatable pandemic. I really wished that you would be also paying tribute and also assessing the successful ministries that were taken as a role model. I wish you were attending that particular event, and as a result we are going to effect a training center to be able to teach the Egyptian experience to be taught to almost 97 different hospitals worldwide. In the fact, the huge success is the transformation of every governmental service to be dedicated only to the citizen, from the governing and the directory and Gahar initiative, and also the different efforts that were taken by the collaboration of ministers. All of that is dedicated only to the Egyptian citizen.
Independent Advisory Oversight Committee.
Now I can also say that now they are also they asked to see the health inspection. They have visited one of the health institution or a health center that was inspected by a very important and very well educated and very experienced expertise who have inspected medical services and medical centers here in Egypt that is used by the health initiatives and by the health ministry. And I've had myself inspected personally in one of these centers. I have tested myself for blood sugar and for my weight and obesity and some other x-rays, and I really admired it. This center was accredited by Gahar institution, which is a good proof that it is a super quality center that is also sustainable at the same time. So it's not only a good quality, but it is sustainable at the same time. Now the professionality of the people who were testing me and who were performing the x-rays on me were assessed highly by me. It proved sustainability. We're talking about virus C, the eradication of virus C entirely from the face of Earth, as the first country, such a country like Egypt. How did Egypt, in only 100 million population, would reach to that extent of only in a span of almost 1 or 2 years eradicating entirely from the face of earth virus C. It is just because of the political will and because of the collaboration of its different ministries. And it's also the continuous upgrade of medical culture and social culture that is being upgraded by the people who are in charge and have the will and urge to improve themselves. The one who inspected this center just stated that it is the first time in my life that I've witnessed a medical center with that high qualified services. All of it, most of them women, bringing those excellent service. Now we have reached our final stage. We're going back again to His Excellency Dr. Khaled Abdel Ghaffar, Minister of Health and Population.
العام الأول لهذه الاستراتيجية ما هي أبرز الإنجازات وما هي أخطر التحديات؟
طبعا احنا ما قدمناش وقت كتير
Now we don't. Actually, we don't have a lot of time. Let me say that. Let me quote Dr. Noor when she played that's her presentation. If you could ask Dr. Noor to be added to our committees to be a representative for the patients. There is also a decrease in the statistics of the infant deaths in Egypt also. When we talk about infants or toddlers under the age have decreased, but still now I can assess that we did not reach we have affected decrease in the infants, but we did not reach the expected numbers that I'm expecting also to also decrease the deaths of toddlers or people under the age. And also mentioning the obesity that President Abdel Fattah al-Sisi have always mentioned on and on the problem of obesity. We did not really conquer it entirely. We did not reach the measure that I'm expecting, and we still have to spend a lot of effort to be able to stand up to the malnutrition of the citizens under the age, and dwarfism also. The dwarfism is a big problem, dwarfism. We still need a lot of effort, and also the chronic disease that is not being airborne, also delivered from one person, but it is the age branch that is controlling this. And through the health initiatives, if we could be able to follow up with our patients, we could discover those patients through those health initiative, 100 million lives and women and children lives, and those type of health initiatives, we will be easily able to detect those patients and get statistics out of the number that we really need to work on. Those are all things that we really still have to work on. Also the bad habits of eating and nutrition, and also standing up to smoking, the hazards of smoking and beverages, and the excessive use of beverages, which reflects a bad culture for society. Which is also reflecting the excessive use of fast food. Also, we need to spread culture. The media also has to be a partner with us. also the psychological health is one of the most important goals for us also, and it is on top of our agenda. We have to work more of it. We have the also but we have to have the psychological health and also addiction. We have to stand up to addiction. I'll have to stop here to make it short. Thank you so much, Your Excellency. Your Excellency, Dr. Rani Al-Mashat, Minister of Planning, Economic Development, International Cooperation. In the light of globalization, the investment in health, in the health file, in the light of this strategy, having in consideration health justice and all that, how do you assess all those panels or those elements? From now on until 2030, we are looking for economic development that is based on private sector. One of the most important sectors, of course, is the partnership with the private sector, and also a good partner for the private sector is the Ministry of Health. We have too many types of tourism, the health tourism, the other types, some types of health tourism are very important, and also there are many in Egypt. When we also look over the investment, fields of investment and partnership between private sector, 80 billion Egyptian pounds that were invested in the medication industry or the medicine industry, and also hospitals. Also, the industry of medicine is very important to build on. And virus C medicine is a very good example of it. Also, from the economic part, any private investment is helping with a good margin that is helping and that allows to direct other budgets to file of education and other files that are in dire need for help. That's why it's very important. I'm not only talking about the health sector, but I'm talking at large about human development, not only the health sector. Let me also talk about focusing over the all-in-all health file. We all have the urge, and we are all persistent and insistent on working on all sectors of the government. On top of them is the health sector. We also have a chapter on human development that we are going to focus on later on. After this gathering, we are going to be working and spending more efforts on human development, because at the end of the day, any economic development take off would require health and education and industrial development, not only health development. Dr. Ahmed Abdel Hamid Taha, head of the Unified Health Insurance Authority. How do you see Qatar, or how do you see Qatar society or initiative in the near future, to be a real partner with the government to effect good quality in medical services? Thank you so much. Let me just make it clear to my colleagues who are working in the health society, according to the 2018 law that have obliged the Unified Health Insurance Authority to work by the measures taken by this sector. We have derived very important parts of those measures. Those measures that we have derived, we have made the best use of it. We are issuing measures that are valid and complying with international measures. In addition to that, we have also submitted an institution to assess the quality and control sector for all the medical services in Egypt and medical centers. We are assessing all of the medical services and medical institutions in Egypt according to the international standards. The law has qualified us also to extend or expand its activities out of the Egyptian range, to other neighboring countries, also to extend our hands to our brothers in the Arab region. We're working on measures that would provide safety and the best health for the citizen and the patient and Egyptian patients, that would be able to protect them from the malpractices by the different wrong doctors or the other medical institutions. Now it's Mrs. May Farid, the Executive Director of the Health Insurance Institution. What are the opportunities that are provided for you before your hands to provide sustainability when it comes to the medical measures which are going to be taken over in the next 5 years? Let me say, as the health insurance sector, we have our eyes set on investment of all the opportunities that are on our hands, and also on executing our assignments and our role at its best, and also assessing the type of services that are given inside the medical sector. And this is also have a lot to be connected with the budget that is allowed for us. And also we're reaching with our eyes to remote areas, and not only remote areas, but also the far areas in villages and almost every part of Egypt. And also, of course, we are very keen on holding partnerships with the private sector through providing incentives for them and encouraging them. Thank you so much. I would like to, I'm sorry that we ran out of time. Dr. Muharram, head of the Unified Health Insurance Authority, how do you see the future of the private sector investing in the health file? The more we allow the private sector to share in upgrading the medical services, there is going to be availability and accessibility to the health file. We have flexibility, and we're very we have the experience in dealing with the different challenges worldwide. We have acquired that through our business, and now we are also coping with the medical upgrade that is effected in different international medical institutions. And also we are helping in the presence of GAHAR and other international standards is a very important element to be able to empower us while we are doing our job. Also, it's a leap. It's a leap in the medical investments when it comes to the health sector. We have different partnerships we have partnerships in local investment and medical industry at the same time. Actually, there are people who do not really recognize the importance of controlling the prices and prices of the sources for medical industry, so that we would be able to provide it for everybody and not some people. And I really appreciate from the government to be able to have enabled us and eradicated all the challenges between both sides to effect a successful partnership between the private sector and the government, to the extent that we succeeded in penetrating the most sensitive challenges and the most difficult hurdles that have met us. Our final question is for Dr. Naama Saeed Amir, representative of WHO in Egypt. How is WHO going to act as a main partner with Egypt in its national authority? We are working directly with all parts, the governmental and the specialized in health and other. But let me tell you that we as WHO, we are the people who had the best benefit, not only the Egyptian side. It's because of the good experience that we are borrowing now from the successes that Egypt have effected in the past few years, like defying the virus C, the emergency situations like humane aid that is being delivered in the largest way to Palestine and to Sudan, also in crisis worldwide. Also conquering the breast cancer in Egypt is a great leap. Egypt have taken a leap in searching many types of cancer disease and have succeeded in those researches and set an excellent example. Now also Egypt have assessed the cost analysis of those researches. When those analysis and research are published, the whole world is going to benefit from those researches that were done by Egypt. Also standing up to pandemics and standing up to antibiotics and many other successful examples. I would like to thank you so much, ladies and gentlemen, and I thank you, the attendees, for this panel in line with the Global Congress on Population, Health and Human Development. I extend my gratitude to Dr. Khaled Abdel Ghaffar, Deputy Prime Minister and Minister of Health and Population. Thank you so much for your attendance, and my best gratitude and respect to Dr. Rania Al-Mashat, the Minister of Planning, Economic Development and International Cooperation. Thank you so much. My gratitude to Dr. Ahmed Abdel Hamid Taha, the Head of Unified Health Insurance Authority, and Dr. Mai Faroid, the Executive Director of the Health Insurance Sector, and Dr. Tariq, the representative of the private sector, and Dr. Naama Saeed, the representative of WHO in Egypt. Thank you so much.